Hello friends, today we are going to show you a case of bucket handle meniscus tear with ACL reconstruction. So this is the bucket handle segment of the medial meniscus, which you can see very nicely. It has been trapped inside the joint and locked. So this is the diagnostic scopy we are doing. So for bucket handle meniscus tear, you need to be prepared with all sorts of repair techniques. Here you can see we are trying to reduce the meniscal torn fragment with the blunt trocar. So here you can use your blunt trocar, you can use your switching stick from your shoulder set. So there has been also a peripheral bucket handle tear and also an side to side tear from this meniscus that is in the white zone. So that is not very important to us, but repairing the meniscal ream with the capsule is very important here. So before you go in for repair, you need to do the picastering of the MCL to open up the medial joint space nicely. So here you can see we are doing the picastering of the MCL. So your assistant should give a valgus stress in semi extended like 30-degree flex position, and you do picastering to open up the medial space. This space will help you to accommodate the meniscus and also to do the repair under direct vision. So here you can see that we are repairing the meniscus. Now we try to reduce the meniscus. So once you reduce the meniscus, then we can plan for the stitches. So this is an old sort of. Here important thing is that there is a chance of flipping of the meniscus, so you need to be careful regarding that. So once you provisionally reduce the meniscus, then you can give a stay stitch. Here we are using an inside out cannula. Just to hold the meniscus, we are putting a stitch from the fiber wear. So here you can see we are using a stitch of fiber wear, one from the body of the meniscus, another from the capsule. So vertical stitch. So once it is there, then we can pull the stitch from outside, and that will reduce the meniscus. So once you pull both the segments, you can see. Beware of these problems. These are very common problems of knotting of sutures. You need to just be careful regarding that, and you can untangle the knotting of the sutures by pulling it. So these are all practical problems you will face. So once you have your reduction stitch placed in, then you can plan an vertical sort of configuration or horizontal sort of suture. Here we are also using an inside out device, cannula, to put sutures through it. You can use vertical, you can use horizontal sort of. Here we are using an small horizontal sort of stitches. So first loop goes in, then you can put a second one. Especially in old cases, Where the meniscus become hard and thick, it is difficult. You need to use sharp needles and cannulas which have proper trajectories. Here you can see we are facing difficulties to pass the sutures because the body of the meniscus has become very hard. So it has become difficult. So now we are passing it. So this is the second horizontal mattress stitch. So first one vertical stitch has been given, one side by one horizontal mattress stitch has been given, and this is the second mattress stitch. So just to oppose the meniscus. So if you pull, see it is sitting nicely. Then you can add all inside stitches in the posterior part or outside in for the anterior body. So for the posterior most part, we will be using an all inside sort of device. There are many self retaining all inside devices are present in market, but you need to fix the depth, identify the depth and use the proper depth to fix this all inside sort of device. Here for the posterior part, we usually keep it to 18 to 20. For root areas or midline areas, it's better to keep it to 16. Peripheral part, it is we can go up to 18 to 20. So here we'll come with an all inside device and then we'll repair the posterior part. This is the all inside device with the sheath on. So you can keep again vertical mattress or horizontal mattress, but as this is a big tear, so we can plan for one horizontal mattress. That will save, that will be cost effective and that will fix the meniscus nicely. So you need to pierce very nicely and you need to go and get a good depth of bite in the capsule. Once you get a single bite, then you fire one ear button, then come again with rotating, don't just pull, then slowly you can go by the side and give at least 0.5 centimeter of space to 1 centimeter. 0.5 is good one. Then you give the another shot and then you fire the second. So once you fire the second, then you come back with your device slowly, and by rotating the device, that is important, slowly and rotating. So once tightening, you can see that so nicely the meniscus is sitting, and horizontal mattress, though it is weaker than vertical one, but it will be cost effective and it can fix the large part of the tear. So now you need to cut the thread. Once you have enough tightening, so you push the cutter inside and then you can cut the thread. That will complete your all inside meniscus repair. Yes. So see, very nicely the posterior part is sitting. Here we have 3 stitches. Now the tear in the white zone, that we can deal with later on. So once you tie these knots, after that we can see how much we need to repair more. So we have finished putting the inside out and outside in stitches. Now we can see there is an white zone tear, so that can increase, so better to fix it. So we are planning to fix that with an side to side repair with an all inside device, so that tear should not progress. So this vertical tear we are planning to fix it with an side to side stitch by the all inside device. As it is in the white zone, so it need to be very careful. White red zone, white to white red zone. So this will be our first bite. Will come with this. Slowly, and then at the separate segment. So this will create almost like an hashtag sort of formulation. So that will give a side to side configuration, and that will complete our repair. Yes, so you can see that will giving very nice side to side compression. And also there is a peripheral compression of the meniscus, and also a side to side compression of the meniscus. So this type of complex meniscus tears can be preserved and repaired very nicely, and they will give very good results if you are doing with an ACL reconstruction. So from posterior to anterior, you need to repair thoroughly and very stable, and you need to have all the armamentarium like inside out, outside in, and all inside. Thank you for watching. To leave your comments, what do you think, and anything you like to wish to see in future. Thank you all.